Hi, everybody. Welcome to another Beta Change Minisode. I'm Katie, and I'm here with Anna, who is joining me from Armenia today. I'm so excited to speak with her. We're going to talk a lot about having diabetes and what it's been like for us in different parts of the world. And Anna is also a beneficiary of the Katil Charitable Foundation. So I'm excited to learn more about that from her. So hopefully she can tell us. We're going to talk more about that later. So Anna, would you like to introduce yourself?
Yes, of course. I'm Anna. I live here in Yerevan, Armenia. I'm 17 years old. I study here. I basically live here. I've never been I've never lived in other way than I've been living with diabetes for 12 years now and 11 years now. And that's just basically my life.
Cool. So you have type 1 diabetes?
Yes, I do have type 1 diabetes.
And so could you tell me what the Katil Charitable Foundation is?
This Charitable Foundation it has been working with people with just children with diabetes for 9 years now, but the foundation has started building up for about 1 year, and I think it's the only foundation in Armenia who takes care of children with diabetes, type 1 diabetes, and yeah.
Oh, cool. So what kinds of things does it do? And does it, do you guys normally, if COVID wasn't happening, would you be doing camps? What kinds of things are going on through the foundation?
There's once a year at summer, there's a camp happening with this foundation, although it's only a week. But every single children have diabetes when we go to camp, and we just start to get along together, know each other. And it helps a lot of us because there were some children, teenagers, there are even now that are so insecure about themselves because of diabetes. And we start realizing that we're not lonely and we are even better than normal people. Tell us, and we start being more like not insecure about ourselves because of that. And we love it too. We literally wait an entire year because we really, really want to go to camp, even though it's just like a week, but we love it so much.
And camps are something, that we actually talk about a lot through Beta Change. So Beta Change is made up of our founders I'm from the US, and then my colleagues are from Australia and Singapore. And camps are across every country is something that I think everybody has in common. So when I was younger, I've had type 1 for 17 years, and I didn't want to have any friends with diabetes because I thought that we would only be talking about diabetes and it would be like a competition for who was doing better at taking care of themselves. I don't know. I had this idea that was turning out to not be true. So I was wondering if maybe you had any similar experiences before you met other people with diabetes.
Yes, of course. When I first got diabetes, I was 6 years old. I was at first grade. I basically did not understand anything. But when I started knowing what diabetes is, and when I started knowing that I have to inject myself every time I have to eat and stuff, I started feeling very bad. I started feeling very lonely, and I kind of don't know. I felt so lonely, and didn't want to go out and stuff. But when I started going to camp, when I started meeting other people who have diabetes, I basically started to forget about this thing that is in me. And I just started to have fun with life and started understanding that, again, I'm not lonely. And I started feeling less insecure about myself because of that.
I think that's great. I think that's a really good thing that can come from this. So thank you for sharing that. So Anna, what do you study? You said you were studying, you're at university?
Yes, I'm at college. It's here, College of Humanities. I study languages. I study Armenian, Russian, German, English, and from the side I know Persian. So yeah.
That's amazing. That sounds so interesting. What do you want to do when you're done with your study at college?
I really love politics at the moment. I'm hoping to get my life to continue with that, but I don't know what will happen. Maybe I'll just change my profession to something else.
Yeah, it's nice to know that you can still have options, and I think that's a good message for people with diabetes, you know, that you can do whatever we want. So what do you use to manage your diabetes? I use an insulin pump and a sensor. What kind of tools do you use?
In Armenia, we don't have pumps because they're pretty expensive. I'm pretty sure it's from $4,000 to $6,000 a pump. So Armenian government does not give it to us, and not all of us can afford that much money to get a pump. So we only use the pens for like injecting ourselves. And yeah, sometimes we do use sensors, but again, it's too expensive, and it's easier for us to ship it from America to Armenia than to buy it from here.
Wow. So if you were to get a sensor, you would have to pay out of pocket for that.
Yes.
Wow. And what about for insulin? Are there any barriers to getting insulin for people?
No, I don't think so, because we get insulin from our hospitals. In every single whoever is a patient from whatever hospital, they get their insulin from there. And Katil Foundation is one of the foundations that gives strips. I don't know if you know, when you like take your blood sugar, they give the entire Armenia. Yeah.
Wow. So they help people access it?
Yes, they do. They help a lot. Like since they're the only foundation, as I said, they help a lot of people. Like not a lot of people, all of the children. I think we have 680 children here in Armenia who have type 1 diabetes, and they help every single one of them.
That's amazing. So you feel like you can get your insulin pretty easily, but some other things that are like more advanced are a little bit harder.
Yeah. For example, like I live in Yerevan, which is the state of Armenia. So which is the capital, I can get my insulin, or other people who live in Yerevan, very easily. But for people who live outside of Yerevan, they have to come to Yerevan to get their insulin. And that's pretty hard for them.
Mm-hmm. Yeah, because it's not available kind of outside major cities and things like that. Mm-hmm. Yeah. So when you're talking about the kinds of things that the Charitable Foundation offers, so it's like support, access to certain things, and being able to manage your diabetes sort of holistically, like with people helping you. What about things like, do you have like diabetes education classes or anything like that?
We have a school that's called Diabetes School here. It happens in the hospital as well, but since I'm a patient in another hospital, I get diabetes school every single year at camp. There are doctors coming, they talk with us, they explain us everything we need to know and stuff like that. And it happens every day, probably for 2 or 3 days at camp.
Are all of the children who have diabetes in Armenia, are they able to be beneficiaries of the Katil Trust? Or is there kind of requirements to be able to be a beneficiary?
All of them are here. All of them are taken care of from the Katil Foundation.
And is it an acronym? Does Katil stand for something?
Katil means drop in English. It's we say Katil because of the drop of the blood when we take our blood. So that's what it stands for. We just
cool.
Up and got a cool name out of it.
Yeah, I was wondering that, because actually that's how you and I met, because I saw the Katil Charitable Foundation on Instagram, and it seems like the work that they were doing was really cool, and I wanted to know more about it. So they said, oh, Anna might be able to talk to you more.
Yeah, they actually do a huge work. The head of the entire foundation is a woman, which is like, she carries everything on her shoulders, which is not that easy. And all of us literally love her. And she's literally, even if I wasn't this big, I mean, by age, she is actually my second mother, because she takes better care of me than everyone else, except my mom, actual mom.
So I was going to ask you that too. So how did your family react when you were diagnosed with diabetes? Have you gotten support?
I was 6 years old. It was hard. I didn't understand anything. When we went first, we took my blood sugar. It was 12. My family started freaking out, not that much, because it was not that high. But second we took it was 25, and third time my mom was basically out of control. She was crying. She was like, "No, I don't believe this," and stuff. My dad was kind of trying to take control of the situation. He was not showing any emotions because he knew if he showed something, it would be worse. The third time when we took my blood sugar, it was 35. I was almost in coma. So
Oh my gosh.
took me and like right away just injected me and started slowly getting down. My family reacted very bad, I could say. They, of course, every single parent would have reacted the same way. They were so sad and stuff like that. But actually, when I was little, for about 5 to 4 years old, my grandma from my dad's side told my dad, just check on that child, just go check her blood and just see what's going on, because I was drinking a lot of water, I was using the bathroom too much, and just like normal symptoms that happen with people with diabetes. And
So
then
it was learning from everybody. Everybody had to learn a little bit, right?
yeah, because like I started losing a lot of weight. Since I was eating a lot, no one noticed it, but my mom could see it even, like I was losing a lot of weight. So that's when I remember we had a show at school, and after the show, I felt horrible. So that summer, we went to a hospital and checked it, and yeah, that was when we realized I had diabetes.
That sounds really scary. Did you feel scared when all of that was going on?
Actually, no, because I couldn't understand what was going on.
Yeah,
No, I was like, give me food. I'm so hungry. I didn't eat for 2 days. Just give me
yeah.
food.
I was like that too.
Yeah.
I was very hungry, and I remember they gave me ice. They were like, "You can eat this ice," and I was like,
No,
"I want
they
that."
didn't give me anything. I was just drinking water because I was thirsty all of the time. But then it just got better and better, and I started living with it. And at the moment, I can't even remember my life without it.
Yeah, it's one of those things I feel like that you do, and it becomes so automatic in your brain, after over time, um,
Yeah,
which is
it's
funny.
just your lifestyle. It's just right now, I just actually do not remember how I lived before this, how I ate like without injecting myself and stuff. It's weird, but it is what I can't do anything about it.
That's very true. So
Hmm.
Anna, I wanted to ask you about maybe some positive experiences you've had as a result of being diagnosed with diabetes. Do you want to share any with us?
Of course, basically, I am who I am because of this, because of people around me. If most of my friends, like I could say 99% of my friends, not even 98 or 99% of my friends are people from who have diabetes, like from camp and stuff. And they changed me a lot. The foundation, the having diabetes, having this thing that's called diabetes changed me a lot, because like I don't remember how I was, but people keep saying I was not selfish and stuff. But I feel like I was a lot more selfish, a lot more just thinking about myself before I had diabetes. But now, like if I see someone who's feeling bad outside, I will go and help them without even thinking twice. That's what diabetes taught me, and I hope it's a really good thing.
That sounds like a really great thing. Thank you for sharing that with us. I think that's so lovely. And that's really introspective of you to be able to think like that, I think, because I think most kids aren't aware of how
Yeah,
they
like
feel.
most kids are, again, even though they're old by age or like 17, like 16, even 18 years old, but they are still so insecure about themselves because of diabetes. Some suicidal things wanted to happen back in the days because of diabetes. And I don't know, it's just the mental health that people grow inside of them. Like I'm not as perfect as others, and stuff like that. I was not like that ever. So maybe that's why I always thought of myself like I'm better, I'm as good as they are. Because since I got diabetes when I was so little, I didn't understand anything back then. And I grew up by people telling me I'm good, it's a lifestyle, don't worry about it. Probably that's why I'm not that insecure about myself.
Hmm. And do you feel comfortable injecting yourself in public places, for example? Like, I'm just curious because I know people have different, levels of comfort with that or with sharing about it. So I was just wondering if you want to talk about that with us.
In Armenia, diabetes is not as respected as in other countries. Yes, I am comfortable for like injecting myself in public and stuff, but there are certain places where people can look at you a different way and like talk about you a different way, and you start feeling a bit into you, and it starts getting into you. So that's why not in every single place, but sometimes, yeah, I am very comfortable of being like free outside in public.
What, can you give me an example maybe of why it's not respected, or maybe how you think diabetes is treated in another country compared to Armenia?
And for example, in America, people basically don't care if you have diabetes or don't. In Armenia, if someone sees you injecting, it's a bit like the way of thinking for Armenians is a bit different. So like if you inject yourself, they might think you're doing drugs or something else. That's why people, especially teenagers my age, are a bit insecure about like injecting themselves in public. But like a bit olders are probably not, don't even care. But like us who have friends and stuff might think other people would think otherwise about themselves. That's why we're a bit more like closed. We don't like to be exposed that much.
So do you think if maybe people were to learn more about diabetes across the country, if there was more diabetes awareness, do you think that would help, or do you think it's something else?
Of course, that would help because, like, I know people who even. I had a friend who has diabetes, and someone the other day asked her, "Oh my gosh, how are you gonna have a child if you inject yourself?" And like that's because of not being educated about diabetes, and just telling that into someone's face who has diabetes is kind of harsh. And yeah, that's of course it is because of not being educated of diabetes. So if there was like a bit more educational levelness here in Armenia about diabetes, it wouldn't be this hard for everyone.
Can I can agree with that too. I feel like everywhere people can always afford to learn more about diabetes specifically. But I think across the world there are so many people like yourself who are really compassionate and want to be able to teach other people or help other people. So I think that's really great that you want to do that. Do you have any kind of? I was wondering if you do any kind of projects with either the Katil Fund or on your own, like to do any kind of diabetes advocacy?
Projects we have, as you know, November 14th is the World Diabetes Day. Katil Foundation does a lot of fun stuff with children with diabetes. They do shows in here for Christmas, for Diabetes Day, for Halloween, for nurses, because like in Armenia, nurses have a really great rating. So we try to keep them as comfortable as possible with us. And yeah, we do a lot of fun activities, shows and stuff. And the camp is the best thing that exists in this entire world. I could say that.
Do you have any nurses in particular that you like, that you want to give a shout out on your interview?
I love every single nurse. There's a hospital called Muratsan in Armenia. It's basically directed, like it takes care of children with diabetes, people with diabetes, and the nurses and doctors there are the best that exist in this world. I have my own doctor. I love her so much, but I'm more connected with the nurses and doctors at Muratsan than at my own hospital. It's just the way it is. I cannot change anything about it.
I think that's awesome. I'm glad that we could give a shout out to nurses. And, we have some nurses on our Beta Change team who are diabetes educators. And, I think it's really important for kids with diabetes to have a good relationship with their healthcare team and be able to take care of themselves. And I think that's an important part of that.
Of course, of course. We are who we are because of the doctors and the nurses.
Mm-hmm. So Anna, my last question for you is, do you have anything you want to share for us about maybe something that living with diabetes has taught you? You said you think you're more aware of other people and more compassionate, but I was wondering if you want to share anything else.
Um, just the friendship, just the connection that I have with children with diabetes is just the most amazing thing ever. It's just when I'm with them, I forget that I have diabetes. It does not matter if we talk about it or not. I just don't remember that I have that thing in me. But when I'm with other people, I feel like I'm hiding something and I just don't feel that comfortable around them. And so, yeah, just the friendship, the bond that we have with children with diabetes here in Armenia is just the most amazing thing ever. And again, it's because of the Katil Foundation and their amazing work.
Well, thank you to the Katil Foundation for sharing our Minisode today. We're excited about it. Something diabetes has taught me is that I want to be friends with people who have diabetes, not because they have diabetes, because there are so many awesome people who are doing really great things all over the world. So I've had the opportunity to meet people like you, and I'm really excited about that.
Thank you. Thank you so much.
Of course. And so Anna, in our on the comments that we'll have on this post, we might have some questions later because it's nighttime for people now in Australia and early kind of for people in the US. So sometimes we have people write in questions. So if anybody has any questions or comments for Anna, you can write those in. But we'll let you know if Anna wants to answer them. That would be great. And, we're excited that we were able to join you. And we always are overcoming so many technical challenges in addition to having diabetes. My sensor, do you use a sensor too, Anna? Or
sometimes because like we ship it from America, it gets here a bit late or a bit early. In Armenia, it's pretty expensive. Like if I say for like about $50 to $60 a sensor that wants me. So it's a bit expensive here, but when we ship it from there to here, it's a bit less pricey.
Yeah, I was going to share that mine is failed. I can't get it in front of you. So I don't have, it's not working. So of course that happened like right when we were doing this, which is funny. But I was glad we were able to figure it out and do this live interview.
Yeah, thank you for giving me the chance to experience this.
No, thank you so much for joining me. I really appreciated getting to know you, and I hope that if you're interested in languages, we actually do a global postcard series on our Beta Change webpage. So we share little stories from people around the world, and we publish them in whatever language that the person who writes it would like. So if you would like to write any, we'd be happy to do that. So.
Of course, thank you so much.
Yeah, of course. Is there anything else you'd like to share with us, Anna?
No, that was basically it. That was my life. That's how we live here in Armenia, children with diabetes.
Thank you so much for joining us. It's been really a pleasure.
Thank you so much for having the patience for wait for me with all these technical difficulties.
It's okay. You are not the only one. This is something that we are used to with this. And it's, I feel really lucky to be able to use this technology to meet people who are, thousands of miles away in Armenia. And sometimes this is just the challenge you have to deal with when you're doing that. Because not everyone has the internet and not everybody has access to, the technology. So one other question I have for you, Anna, is actually how has COVID impacted your life with diabetes in Armenia? Has it made it harder for you to get anything or get prescriptions and things like that?
For me, no, because again, I live in Yerevan and it's pretty easy for me to get everything I need. But for people who live outside Yerevan, was pretty hard. But like since it was COVID-19, the government tried to kind of help people with diabetes. They brought like from Yerevan to, for example, Gyumri, they brought the like insulin so people could get it from there. But when like the quarantine ended and everything was over, now they again have to come to Yerevan to take their stuff. But yeah, it was pretty hard, but now we're kind of getting into it. Like we're trying to get over it.
You're getting used to it now, and everybody's kind of doing. Have you been doing telehealth visits? Like, have you been doing this kind of FaceTime with your doctor, or have you been going in person?
No, I haven't seen my doctor in a few months, but
Hmm.
it's okay because I always take my blood sugar and like I since it's like 11 years is not a small amount of time, so I
No,
know what's happening to me.
no, and I think a lot for that's been the case for a lot of people is not they haven't gone to see their doctor in a while. So
Yeah,
mhm.
maybe.
There's going to be a lot of appointments when we all can go outside again. But,
Yeah, it would be amazing if we could go outside again.
mhm. And so, do you feel like has it just been you living with your parents in Yerevan
Yeah,
since we've
it's
had
just me and my
quarantine?
parents.
Do you have any
Mhm.
siblings, Anna?
No, I don't. I'm an only child.
Oh, okay, cool. I feel like an only child because I've been living with my parents, but I've got two siblings who haven't been with them
Oh,
since they've been there.
amazing.
But no, but thank you for sharing that. I just think it's kind of interesting to discuss right now because I think a lot of people are having some new challenges, and maybe to people who are outside of Yerevan are having trouble maybe getting what they need if they're not there. But I just was
Yeah.
interested in learning more about that.
There's just nothing to say about it. It's just they have to come here to get insulin, and that's kind of so bad when you think of it because there are a lot of like states that are very very far away from year one that they have to come and get it from here,
Hmm.
like which is pretty hard. So, for example, you don't have any more insulin in your sugar is like high up to like 40. What are you gonna do when you don't have anything around?
Yeah, exactly. That's really
Mm.
scary to think about. Thank you for sharing that with us. And I wanted to know for our viewers, is the can people donate to the Katil Charitable Foundation? Is that something that do they accept
Yeah,
donations?
they can. Yeah, they can donate if they want to.
Yeah, I was just wondering in case there's anybody that's watching that would like to
They
contribute in that
can.
way.
Yeah.
But it sounds like there's a lot of amazing work going on, so we're excited to have been able to learn about it from you. So
Of course, there is a lot of great work, but since coronavirus, I don't think we'll be able to go to camp this year. But
I know.
everyone was waiting for this moment to come, but let's hope it'll get better till the time when we have to go.
When is it? When do you usually go to camp?
We usually go from like at June or July, like in between those 2 months. But since it was quarantine this year, we are hoping it'll get better till August, so we can go. At,
Hmm. Have you found that places are like reopening yet in Yerevan where you are, or are things pretty closed?
there are places that are open, just not all of them. There are some places that are still like scared to open up, be open for people.
And is that where the camp is usually held?
Camp is held outside of year one. It's held
Hmm.
in a beautiful place called Arzani. It's a beautiful nature, and because of the coronavirus, we cannot have like gatherings, a lot of people gatherings together. So that's why we probably wouldn't go. But let's hope it'll get better because it's my last year since I'm 17. Next year I'm turning 18 and I won't be able to go to camp. So I'm waiting. I'm hoping I will be able to go this year.
Yeah. Would you be able to go and volunteer as a counselor, or do
I
you
hope
hope to go
so.
back?
I hope so. If the staff lets me, I will go. I would love
Yeah.
to.
That's great to know. Well, hopefully they see this and they'll know that you're really interested. That's great. So thank you for sharing that, Anna. I will let you go, but I really appreciate you joining us today, and thank you for everything. It was
Oh
great
my
to
gosh,
speak with
thank
you.
you so much. Thank you for giving me the opportunity to talk about diabetes and to just share my story to talk about the most amazing stuff that's going on here in Armenia.
Oh, of course. And for anybody watching, you can stay connected through our website, the Facebook page,
Mm.
and we have the Katil Charitable Trust tagged in the post, so you can follow them on Facebook as well. And we also tweet out updates from Beta Change. Maybe we'll be tweeting out a global postcard from Anna in the near future, hopefully. And so if you want to catch up on our minisodes, we publish them to our YouTube channel. And for guests who have been on, you can like the Katil Charitable Foundation page or Beta Change Network and get in touch if anybody wants to share their stories. So thank you so much, Anna. I hope that we speak again soon.
Of course, of course. Thank you so much.
Thank you. Bye.